Good evening. Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo, and Kenya today joined the rest of the world in marking the Malaria Day, with calls on elimination of malaria, of course, taking center stage. And the latest report by the World Health Organization, which was released last year, indicate that so far 229 people have suffered from malaria, and of course 409,000 people dying from the disease, and 94% of these cases, children account to 94% of these cases. Let's now speak with the head of the division of the malaria program here in Kenya, Dr. George Githuka. It's really great to see you tonight and to have you on our show. Thank you for your time.
Pleasure.
Yes, and let me ask you, when we celebrate Malaria Day today, maybe of what significance is this day in the country? And this question I'm asking in regard to finding out where we are in terms of the statistics of the malaria cases in the country and the people dying from this, and which regions are affected.
Thank you. I think the Kenya joins the rest of the world in commemorating World Malaria Day today. And for us, it comes at a significant time where we have ambitious targets to be able to reduce the disease burden, the incidence and the deaths from malaria. As was announced earlier today, we just released some preliminary results from our Kenya Malaria Indicator Survey that we did in the year 2020. And it showed that our disease burden, our prevalence from malaria countrywide had reduced from 8% in the year 2015 to 5.6% in the year 2020, which is a significant decrease. Amongst the highest burden counties, the lake endemic counties, the counties around Lake Victoria, where the prevalence was 27% in the year 2015, this prevalence has dropped to 19% in the year 2020. And in the coast region counties, the counties around the Indian Ocean, the prevalence has dropped from 8% to 4.5%. However, despite this progress, malaria still remains a major challenge in Kenya, a health challenge in the country, it's the second leading cause of outpatient hospital attendance, only after diseases of the respiratory symptoms. 15% of all the people who will visit an outpatient or who will visit a hospital at any given particular time will be due to malaria. And as you've rightly put it, pregnant mothers and children under 5 are most vulnerable to suffering severe malaria, which is a leading cause of adverse pregnancy outcomes. Malaria is a leading cause of loss of pregnancy, early and late. It's a leading cause of stillbirths. It's a leading cause of premature birth and even low birth weight. And it's also a leading cause of maternal mortality. And as you rightly put it, it's a leading cause of childhood mortality. So despite the progress that we've made, and our ambitious target we have of eliminating malaria in Kenya by the year 2030, malaria still remains a challenge of public health concern in the country.
Yeah, and maybe I wanted to ask you about the target. You're saying eliminating by 2030. Probably there was a regional, the African target of reducing it to 40%, and you're saying that the cases have reduced here in Kenya. Maybe what strategies are you using as a ministry, and looking at from the survey that you conducted from, let's say, 2016, and the rate at which the infections are reducing, do you think that it's possible this can be attained, that by 2013 we'll be saying that Kenya is a malaria-free country?
Yes, we believe that. We attribute the decline in prevalence of malaria between 2015 and 2020 to 4 strategies that we've implemented throughout that duration. Number 1 is the issue of issuing of insecticide-treated nets. We use a dual strategy where we do continuous distribution of these nets to pregnant women and children less than 1 year old. And we also do mass net campaigns every 3 years. The last campaign was in the year 2017, and today we've just launched the campaign for the year 2021. So insecticide-treated nets are one of the big strategies that we've used, and we normally target 70% of Kenyans who are at risk of malaria. The second strategy that we do is the indoor residual spraying. This happens majorly in 2 counties, Migori and Homa Bay. and it's quite an effective way of controlling the malaria parasite spreading vector, which is a mosquito. The number 3 strategy that we implement is early diagnosis and treatment for malaria. The malaria spreading parasite mosquito can only spread the parasite from one infected person to an uninfected person. So if an infected person is able to seek treatment early, is tested for malaria and put on appropriate treatment, then this not only saves the life of that person who has been treated early and protects them from developing severe malaria, but it also ensures that the mosquito is not able to spread this parasite from one person to another. I think as we move forward to the next phase, that we'll be able to accelerate our progress towards eliminating malaria in this country. Kenya is one of the 3 countries in the world piloting the malaria vaccine. We started administering the vaccine in September 2019. The vaccine is targeting children between the ages of 6 months and 24 months. And it's a 4-dose vaccine. The first dose being given at 6 months, second dose at 2 months of age, the third at 9, and the final one at 24 months. And since the launch of this vaccine in September 2019, we have started seeing children now who are getting their 4th dose and completing the vaccine. And we are seeing encouraging results from this. And we expect and we hope that this will be able to be a meaningful contribution towards the control of malaria. The last thing also we're introducing in the country is the issue of larva source management, the spraying of the malaria, of the mosquito breeding sites, targeting the larval stage of the mosquito. And this is a strategy that we're implementing in the high burden counties along the lake. So this mix of interventions, their sustenance and their scale up, we believe we'll be able to accelerate us towards achieving our target of eliminating malaria by the year 2030.
Let's talk about the last strategy on the use of the vaccine. Is the vaccine meant to prevent one from getting the disease once bitten by mosquito, or it's reducing its implications?
The vaccine is meant to prevent one from acquiring malaria when they have the vaccine. The vaccine is not a replacement of all the other interventions, because we'll find mothers asking, now that my child has been fully immunized, they've gotten the 4 doses, and the vaccine is expected to be effective. Does that mean the child does not sleep under a mosquito net? Does that mean that if a child develops a fever, we don't seek, treatment for diagnosis and treatment of malaria? We're telling them, no, this is just another arsenal. There's no magic bullet in the fight against malaria. So the vaccine comes to add onto the arsenal that we hope and we expect that should be able to reduce the incidence of malaria and also reduce the deaths from malaria.
And what's the effectiveness of this vaccine?
The vaccine, as I said, we are piloting it in 8 counties in this country. In the counties around Lake Victoria, the high burden counties. This vaccine has been found to be effective in clinical settings.
In terms of percentage?
In terms of percentage in clinical settings, it was found to be 39% effective. But as I said, Kenya is not the only country implementing this vaccine. We have Malawi and Ghana. And I think Malawi is a bit of one step ahead of us. They started implementing it earlier. And the results that we're getting from there is showing higher percentage of effectiveness of this vaccine. So as a country, we're really looking forward, since now we have children who've gotten the full dosage, to also be able to assess the effectiveness within our own settings and be able to scale it up and expecting it to avert the disease, the incidence and deaths from the disease.
And the Oxford University did release some report of a new vaccine, which they say it's 77% efficient. Maybe you can, is the country looking into having this new vaccine?
Actually, this is a vaccine that we are piloting. That is what I was saying. There are a country like Malawi, which is much ahead, and they're already releasing some preliminary results, which are showing it's 77%. So it's the same vaccine that we are piloting, and this is quite encouraging. But we don't want to preempt our own results, and we hope that it will reflect the same, if not better.
And because you're saying that you said that malaria accounts, it's the second leading cause of death?
Of hospital visits.
Hospital visits.
Yes.
So what's the greatest challenge in addressing malaria in Kenya, especially on the endemic counties that you had mentioned?
I think the greatest challenge, as I said, we dedicate a lot of our resources, a lot of efforts in prevention, but we also say that when you have when you are not feeling well, malaria presents with fever, joint aches, headache, feeling of weakness. We do encourage people to seek treatment early, because when you seek treatment early, we do have enough healthcare workers, we do have enough equipment to be able to test you early. We normally don't treat malaria presumptively. We have to diagnose you correctly, either using a rapid detection kit or microscopy, and treat you early. The medication that we have for treating malaria is efficient, it's effective. There's been we don't have any evidence of resistance to treatment in the country. However, when someone delays seeking treatment early, then they develop severe malaria. And severe malaria is quite difficult to treat, it's quite complicated to treat. And you find a lot of the deaths that occur from malaria is mostly because of delay in seeking treatment. And so we usually say that that is the biggest challenge. If everybody could seek treatment early, then we'll be able to avert almost all deaths due to malaria. And also, as I said, early treatment is able to also interrupt the transmission cycle by ensuring that the mosquito has no malaria parasite to transfer from one person to another.
And are you experiencing situations where people are not seeking treatment? Because there was such reports that emerged that people are not now going to the hospital because of fear of the COVID-19 pandemic. From 2020, when we reported our first case till now, would you say, what would you describe the behavior of Kenyans in terms of seeking treatment?
I think this is something we're still looking at. But from what we've had, anecdotal evidence is that a lot of people are now seeking treatment without proper diagnosis. As we said, we do not recommend anybody to be treated for malaria before they are tested. But you find that still quite a number of people, when they have a fever or they feel like they have symptoms that resemble the symptoms for malaria, they'll walk into a pharmacy, a chemist, a clinic, and describe their symptoms, and without being tested, get treatment for malaria. This is not encouraged because, one, you might not be suffering from malaria, and so you'll get a complication for whatever you're suffering from. But two, also it will bring about the issue of resistance. So I think that has been one of the things that we've seen. But however, we're encouraged, especially by the results of the malaria indicator survey that we did last year. We did it towards the end of the year, in November, December, when we were within the context of COVID-19. And we did not see quite a remarkable reduction in people seeking health services when they have symptoms similar to those of malaria. But we still continue to encourage. We have developed a lot of health messages that encourage people to be able to seek treatment. That you don't assume that it is malaria, or don't assume that it's something else, but always go to a health facility, get the proper diagnosis, get the right treatment, and you'll likely get the right outcomes.
And looking at the report by WHO that Africa, Kenya included, is yet to reach the 2020 target of 40%, reducing the incidence to 40%, and also morbidity. Now, let me ask you, because I'm looking at the pandemic, and a lot has been going on and much efforts being put on the pandemic. Are we experiencing such a problem in Kenya where maybe the pandemic has affected somehow the response? And number two, why do you think we as Africa are yet to get to the target that we had set at 40% by last year?
So two things. I think number one, as we said, malaria is one of the diseases that are of public health concern. There are also other diseases. There's HIV, there's tuberculosis, diarrheal diseases, respiratory illnesses. And you find in a context where we have limited resources, then it's a challenge to be able to focus on one disease area. So a success in the control and management of one disease has to be aligned with the success in the control of all the other diseases that are public, especially the infectious diseases. And you find that with the coming in of COVID-19, then there is a shift in focus, there is a shift in resources, and you find, and this is globally, you find that you have to sustain. For us to be able to achieve our results and be able to progress forwards, we have to sustain the focus on malaria. So it's within that context of other emerging, other existing, re-emerging infectious diseases, You know, like for example, we say that it's known that the Democratic Republic of Congo is one of the leading, is actually a leading country in terms of malaria. But you find it's within the same country where you have the challenges of, for example, Ebola, etc. So maintaining that focus is really key. Dedicating resources towards the fight against malaria is key. And coming up and scaling up new interventions is also key.
Okay, and is Kenya, your division, are you experiencing such a problem?
I think for Kenya, we are glad to say, and as the malaria indicator survey results have shown, that we've been able to sustain our efforts. I think we have good partnerships. Number one, our partnerships with the county governments, health departments that continue to allocate resources towards the fight against malaria. We have good partnerships with our bilateral and multilateral partners, the Global Fund against AIDS, TB and malaria, the USAID's Presidential Malaria Initiative. We have partners like Amref Health Africa that are key in offering malaria services at the community. And the community itself, we have seen a sustenance, especially in the high burden counties. They do recognize malaria as a key cause of illness, as a key cause of deaths, as a key cause of poor health outcomes within them. And they have sustained, despite even the COVID-19 pandemic, sustained the focus on malaria. And that is what we attribute to having these encouraging results from our malaria indicator survey.
And let's talk about the program that you launched, how you intend to use innovation maybe to curb malaria moving forward. Just tell us how it looks like and who you're targeting.
The three things that we launched this year, of course, was a mass net distribution campaign, and we said that we target the 27 counties where malaria transmission occurs, targeting 25 million people within the country. We have been able to work in partnership with the counties and with the support of the partners that I've listed to be able to do this. And normally we'll find once these nets are distributed and they're used appropriately, the incidence of malaria usually drops marginally. When we combine this with the larva source management, the spraying of the malaria, the mosquito breeding sites, and also the malaria vaccine, together with the indoor residual spraying, a combination of all these interventions, if we deliver them effectively and to scale, amongst the 70% of the population that is at risk of malaria, we expect that by the year 2030, we will have achieved the goal of eliminating malaria. I think also what was said today is that the elimination agenda started in the country. And we are started to target a few counties in this country. We said Nyandarua, Laikipia, Kirinyaga, and Nyeri. These are counties at the center of the country. So we want to start eliminating malaria from the center moving outwards. You realize for us to be able to eliminate malaria in the counties along the border, especially in the counties along Lake Victoria, where they neighbor Uganda, they neighbor Tanzania, and sometimes South Sudan, that we also need to work in collaboration with those countries. Because, the malaria, the mosquito, the malaria spreading vector does not recognize boundaries. So we're also working together with those countries. We have a cross-border collaboration where as we move outwards, from the center outwards towards eliminating malaria, we're also working in collaboration with those countries so that as they work on that agenda, then we shall have, we are calling it the Great Lakes Malaria Initiative that includes the DRC to be able to eliminate malaria together as a region and achieve that goal by the year 2030.
Okay, thank you for that. So what are some of the treatment options available for malaria and their cost implications?
Malaria is, as I said, it's not a difficult disease to treat. In Kenya, we've been using consistently one drug as a first-line treatment for malaria. We call it temethal-lumefantrine. And we've been conducting studies to see how it's effective in treatment. It has continued being effective. And that is a drug we recommend for treatment of uncomplicated malaria, which I said if diagnosed early, 100% of the people will be treated. For the people who develop severe malaria, then we usually treat them with an injectable drug called injectable artesunate. And once they are well enough to be able to take oral medication, then we transition them to a temethyllumefantrine. So I think to summarize this is to say that the cost of treating malaria and diagnosing and treating malaria is not much if that is done early. And it is easy, it can even be treated at the community level. We have community health workers who test and treat for malaria at the community. They go with test kits and treatments for malaria at the community, and they diagnose and treat. It is not complicated. Malaria treatment becomes complicated if you delay in seeking services or accessing these services. So for us, I would not say management of malaria is a major concern. The concern is prevention of malaria, and that is where we dedicate a lot of our resources.
Right. And talking about the delay in seeking treatment, does it have anything to do with anti-malaria drug resistance? And are we experiencing that in Kenya? How are we dealing with it? Because it has been an issue.
The delay in treatment is not attributed to resistance to anti-malaria treatments. Indeed, as we speak, as a country, we are doing what we call treatment efficacy studies. We do these studies every 3 years to be able to check the effectiveness of the drugs that we are using, to be able to detect any emerging resistance to the drugs that we are using. And also we'll be, we're anxious to see what the results will show. Because as you've rightly put it, in some other African countries, there has been emerging resistance to the current first-line treatments that we are using. But the development of severe malaria in this country is not because of drug resistance. It's purely because of delay in seeking treatment. That is due to many factors. Sometimes we have counties or regions where health facilities are far apart and people have to travel long distances to seek treatment. And in these counties, we've put in the community health strategy, which community health workers go to the community and provide services, which include malaria. There is also the issue of poor health-seeking behavior amongst individuals, particularly men. And this we reach them through social behavior change communication messages that encourage people to seek treatment early. It's very common for somebody to, especially when you are not feeling well, to assume that it is one thing while it's another. So while you are making that assumption, then you are delaying seeking treatment, and complications and development of severe disease arises from then. And that is why we say there is no mild illness. You cannot assume, when you have a headache, when you have some muscle aches and some fatigue, you just go to a chemist, maybe buy some paracetamol or buy some drugs. You assume it could be a flu. Right now there is COVID, people assume it's COVID and you self-treat without diagnosis. Then you find by the time people are coming to the facility, then they are already in the severe stage of the disease, whose outcomes are normally poor. Like I was saying earlier, if a pregnant mother does not seek treatment early, it can lead to loss of pregnancy. When a child is not brought to a facility early, it can lead to the death of this child, or even other outcomes that are not favorable, like malnutrition, growth retardation, and which can be permanent and affect this child for the rest of their lives.
And that's what I wanted to ask you about self-medication and over-the-counter drugs, because when you go to the hospital, you asked, especially if you are in Nairobi, they ask you, had you traveled outside the city? And when you say yes, then they suspect it's malaria. But that's the same case with COVID, and the symptoms are alike. Do we have distinguishing symptoms between the two? Because there's fever for COVID, there's body pains, Just let's talk about the symptoms.
The symptoms are quite similar.
Yeah.
Even the symptoms for COVID are evolving every day. It's a new disease we don't know. But some symptoms are standard. Fever, headaches, muscle aches, feeling tired, maybe poor appetite, some maybe nausea, vomiting. And these are symptoms that are similar to very, very many illnesses that we know. So that is why we do not encourage someone to self-medicate. If you seek treatment early and you get diagnosed correctly early and treated appropriately, then the outcome is going to be better than if you try to self-medicate. And that's why we also work together with the private pharmacies, the chemists, the private clinics, to encourage them not to dispense drugs over the counter, to encourage to either have these tests with them. As I said, tests for treating malaria are easy, and you can be able to even do it at a chemist or at a pharmacy. It can be done at the community. So we try to partner with these small clinics and pharmacies and chemists to either diagnose, or if they are not diagnosing, then they can refer this client who comes and reports to have these symptoms and I want drugs over the counter to help facilitate to proper diagnosis. Because this over-the-counter dispensation of drugs does not only bring about resistance to anti-malarial drugs, it brings about resistance to antibiotics, it brings about resistance to other antimicrobial agents, and makes treatment of these diseases that would have otherwise been easy to treat much more complicated, because you already exhaust the options that you had. As you said, you go to a health facility and tell them, I had already taken this medication, and probably you didn't finish the dose, or you are not treating appropriately, and they diagnose you with an illness, then that knocks off that medication from what they're supposed to give you. And you end up getting something more expensive, something probably less efficacious as what you could have gotten, because you misused, in quotes, what was appropriate.
Okay, so who is at a risk? I know we talked about children, we talked about pregnant women, but who exactly is at risk? And when we talk about pregnant women and children, are they the ones at a risk of developing complications, and the rest of the population the disease can just disappear on its own? Or just elaborate on that.
No, I think, yeah, as I said, pregnant women and children are the ones at risk of developing severe malaria, of having bad outcomes. Like I said, mortality in children, mortality amongst the mothers, adverse pregnancy outcomes. But everyone is at risk, especially the people who don't think they are at risk. If you don't seek treatment early and you develop severe malaria, it's difficult to come back from it. And also, if you don't seek treatment early, as I said earlier, the mosquito spreads malaria from one infected person to an uninfected person. So if you're in a household, if you're in a community and you have malaria and you don't treat it early, then you act as a reservoir for the parasites. For any mosquitoes that bite you, then they bite someone else, they spread malaria to them. So by not seeking treatment by yourself, you're not only risking your own life, but you're also exposing other people to malaria. You can imagine if we had a community that nobody had malaria, even if the mosquito was there, there'd be nothing, there'd be no parasite for the mosquito to spread. So that's what I was saying, seeking early treatment, it's not only beneficial to you as an individual, but it also ensures, it reduces the transmission of malaria to the people around you and to the community. And that's why we say nobody is not at risk. Everyone is at risk, and severe malaria always ends up with, poor outcomes.
I'm told we have 2 minutes to wind up. I don't know whether you're able to answer this. There's someone asking whether there are different types of malaria that we have and which one is more serious.
At the country right now, we don't have different types of malaria. We have the malaria that is caused by Plasmodium falciparum, which is a parasite that causes malaria in the country. I know in other countries there are other species of the parasite that cause malaria, and it's the severity of the disease. Again, I would like to emphasize the severity of the disease is not because of the agent causing it. It's because of the health-seeking behavior. So if you seek health services early, then whichever parasite, because again you could have traveled outside the country and gotten exposed to another species of the malaria-causing parasite. Whatever it is, if you seek treatment early and get appropriate treatment, then you will not develop complications.
Okay, Dr. George Githuka, thank you so much for making time for us and for this discussion.
Thank you.
Okay, and that's the end of our discussion tonight. Thank you for being part of this program. I'm Purity Museo. Byron Abuli has been our sign language interpreter tonight. Do enjoy the rest of the week. Stay safe, wash your hands, sanitize, and socially distance if you can. Good night and God bless.